Thank you everyone for joining me for the Kinship Care Supports Request for Proposal Leaders Conference today. After a few months of waiting, it's finally released on July 22nd, and we will be holding the Leaders Conference today for a chance to go over the RFP as well as the strategies, Zoom grants, and some other stuff. But I have an agenda that I will go over shortly. Again, thanks for joining us. The video will be recorded and uploaded to Zoom grants as well as the VSHSL afterward. So if you are not able to make it, or if you know someone that would like access to it, they can have access to that afterward. I just, before we begin, I just want to check if everyone can see my screen okay. I'm sharing the PowerPoint for my Leaders Conference.
Yes, I can see it.
Okay, wonderful. Okay, great. And for those that are on the phone, you can access the recording later as well. So before we begin, I just want to acknowledge that we are on the traditional land of the first people of Seattle. I have someone in the waiting room, sorry, never mind. Okay, sorry. So we would like to acknowledge that we are on the traditional land of the first people of Seattle, the Duwamish people and coastal Salish people, past and present, and honor gratitude the land itself and the Duwamish tribe. Yeah. If you want more information, you can visit this website right here. Right, so I want to do some welcome everyone and do some introductions before we begin. So I can introduce myself, and then if you can go ahead and tell us your name and the organization that you work with, that would be great. So my name is Nikki. I'm the program specialist with King County Department of Community and Human Services with the Veterans, Seniors, and Human Services Levy. And I coordinate the request for proposals for Kinship Care Supports. And welcome everyone here today. So I guess I don't have a roll call, but I guess everyone, whoever can begin, go ahead.
Hi, my name is Alicia Kennedy, and my organization is Women United, support for grandmothers raising grandchildren. Thank you.
Hi, Alicia. Thanks for being here.
Hi, this is Barb Taylor. I work with the King County Kinship Collaboration that is located at Catholic Community Services in Seattle.
Hi, Bob. Welcome.
Thank you.
And this is Holly Ann Monson. I'm the Kinship Director at Catholic Community Services.
Hi, Holly Ann. Good to see you.
My name is Lace Lawrence, and I'm the grant writer for Atlantic Street Center.
Sorry, can you say your organization again?
Atlantic Street Center.
Oh, hi, welcome.
Hi.
Hi, my name is Nicole Mason, and I'm with Amara.
Hi. Thanks for joining.
Hi, my name is Ursula Rosenrunge, and I'm with Guided Pathways, Support for Youth and Families.
Hi, Ursula.
Hi all, this is Chris Sanborn with the YMCA Social Impact Center.
Hi, Chris. Thanks for joining us. We have a few more folks on the line.
Hi, Michelle McBrain. I'm the Community Outreach Manager at Treehouse.
Hi, thanks for joining us.
Hi, this is Veronica Milligan with Center for Human Services.
Hi, thank you for joining us.
Hi, this is Laura Lewis from Encompass.
Hi, thank you for joining, Laura. I don't know if I missed anyone else. Is there anyone else that haven't introduced yourself?
We had one person in the chat, Jordan Louie with the YMCA.
Okay. Hi, Jordan. Hi, Jordan. Thanks for joining us. Right. I don't know if I'm missing anyone else, but I think we just have Bill joining us. Bill, do you want to introduce yourself and which organization you work with? Can you hear me? Bill, can you hear me? Okay, great. If you feel more comfortable typing your name and the organization you work with in the chat, Virginia can help me monitor that. Okay, so we just want to remind everyone that if you are not talking, if you can mute yourself so that background noises, that would be great. So for the agenda today, we will be covering what is the Veterans, Seniors, and Human Services Levy. I will go over the overview of the strategy, social engagement to see kinship care supports, the IEP itself. I will go over information for technical assistance and capacity building. I will go over Zoom grants, how to apply, and then there will be a chance for questions and answers. And again, the questions that I will receive today, as well as questions that will be submitted, will be responded and uploaded to Zoom grants under the library section. And I will remind you that throughout the presentation. It will also be uploaded to the VSHSL website to give fair and equal access to everyone. So everyone will have access to that. Okay, so what is the VSHSL? It is so it's the acronym for Veterans, Seniors, and Human Services Levy, and it promotes housing. Sorry, I'm gonna admit people as they enter the room. So it promotes housing stability, financial stability, social engagement, healthy living, system access and improvement for veterans, seniors, and vulnerable populations. It was passed by King County in 2017. Sorry, could you mute yourself, please? Thank you. So it was passed in 2017. It is a 6-year property levy tax from 2018 to 2023. The first year of the levy was the transition year, guided by the implemented transition plan that mainly continued services and program from the former Veteran Human Services Levy. So the senior piece is new. It just added to this new initiative. And the VSHSL implementation plan guides investment for the remainder of the levy, which is the 5 years from 2019 to 2023. Just let's see if there's anyone waiting in the waiting room. Okay, great. For those that just joined, if you can type your name and the organization you work with in the chat room, my colleague Virginia will help me keep track of who's on the call today. Thank you. The guiding principle of the VSHSL is to build and improve connections. Connections among the people the levy serves and among the people and organizations that provide the levy's services. So we learned that people do best when they feel a sense of belonging based in personal relationships and connections to the communities. So those are the guiding principles of the levy and VSHSL. Equity and social justice is key to the work of the levy and embedded as principles throughout the RFP itself. So when we do outreach, we make sure to reach organizations that have not been served before, and we try to provide outreach as well as prioritize funding for those populations that have not been previously have access to our funding. So we seek to support organizations that are reflective of and embedded in the communities they serve, and recognize and address the disparities and disproportionality that exist in our communities. The overarching goal of the Levy is to ensure that all people, regardless of who they are and where they live, have the opportunity to thrive with full and equal access to opportunities, power, and resources. So I'm going to go over the strategy. So if you want more details, I'm going to give a high level over summaries of the strategy here, but you can read the strategies in details in the implementation plan on page 91 and 92. So basically, this is the strategy for kinship care supports for seniors. And in the implementation plan, it outlines that it is estimated that about half of kinship care givers are seniors. And caring for a child is tremendous hard work, and there are very, very limited resources available in King County to support kinship caregivers. And there have been research that kinship caregivers can succeed when they are able to maintain their health and well-being as they provide for the children in their care when they have the necessary support. So this is a little bit background about the kinship care information nationally, as well as Washington State and within King County. So I will go over that briefly, and these are some of the background that guides the scope of work for this IRP. There are information stating that kinship caregivers care for about 43,000 Washington children outside of the state's formal child welfare system. There are 4 times as many children raised in informal kinship care arrangement than there are in foster care. About 91% of informal kinship caregivers are grandparents. And kinship caregivers face common challenges, including financial concerns, problems with transportations, needs for access to social services, respite care, child care, and counseling. And they also face challenges navigating the complex public social services systems. They don't know where to turn for resources, especially when they are in the early stage of connection. Many lack information and training on available services, policy, and potentially applicable laws and regulations. And with all that said, the state only spends about $31 million a year on programs and financial support for kinship caregivers, compared to more than $315 million for foster care and adoption. That is a huge difference. So we held a community planning session, I believe back in March, and met with many individual organizations and individuals who are experts in kinship care to learn about the needs and how to best use the funding for this strategy. So the information that I have gathered have informed the development of this IRP. So based on the information that I gathered, the purpose of this IRP and investments is it seeks to fund an entity or entities to provide support to senior kinship caregivers who are 55 and older living in King County, especially those in the early stages of the kinship care connections, with priority given, but not exclusive to informal kinship caregivers. So formal kinship caregivers are eligible for this program, but priority will be given to informal kinship caregivers to help them be successful in their roles and increase their ability to maintain their health and well-being while providing for the children in their care. So that's the purpose of this strategy. So the scope of work, sorry, I have 3 people waiting. Okay, great. For those that are waiting, if you can type your name and the organization you work with in the chat room, my colleague Virginia will help me monitor who's in the chat room. And if you have any questions, you can type in the chat room as well. I just want to remind everyone again that the Beaters conference will be recorded and uploaded to ZoomGRANTS and the VSHSL later. So if you have missed part of it, you can access to the full presentation afterward. I want to go over the scope of work of this IRP. So based on the information that we gather, there are a lot of needs, but we have identified 3 top needs that we want to allocate this funding toward. And so an applicant or applicants can apply for one of the following program components. So the funding is divided into 3 parts, and you can either apply for one of them or all 3. And the 3 program components include kinship mentoring, and that you can apply up to $75,000 in 2020 and $100,000 annually from 2021 to 2023. And for kinship mentoring, we are seeking an organization to provide person-centered mentoring to senior kinship caregivers, especially during the early stages of providing care, to help caregivers be successful in their new role. And you can find more information in the RFP, but the roles of the kinship mentoring includes, but is not limited to outreach, work with the kinship caregivers to identify needs and guidance to help them make informed choices, connect and provide care, coordination to needed services and resources, advocate for provision of services when necessary, and monitor, follow up, and evaluate services provided. So those some of the roles of the kinship mentor. And the second program component is flexible funding, and you can apply for that up to $100,000 annually. So that's for both this year as well as 2021 to 2023. And the flexible funding is to support the unique and specific needs of the kinship caregivers. And some of the examples could be one-time rental or mortgage assistance, purchases of school supplies for children in the care of the kinship caregivers, short-term child care placements for respite, car repairs, food, anything that goes under transportation. So that includes bus pass, taxi vouchers, it could be Uber, credit. But those are some of the things that we heard are necessary, and there's not enough funding, available funding currently to support that. So I just want to put that in the RFP. And I just want to point out that there are flexible funding available right now, but the needs are much higher, and there are some restrictions as well as guidelines that they have to meet. As for our flexible funding, it's a lot more flexible than that. So if you look under, the details in the IRP, you will see that we have outlined a lot of the examples that the other flexible funding might not cover. And it's flexible and open. So check it out and let me know if you have any other questions. And then we also want to allocate part of the funding for training. So you can apply up to $23,350 in 2020 and $50,000 annually from 2021 to 2023. And the training component is for an organization to provide community-based and as appropriate culturally, linguistically, and geographically accessible training workshops county-wide that include access to childcare as needed, as a lot of these caregivers have children in their care. And so I have heard that it's very difficult for them to attend training if if there's no childcare available. And the funded organizations could provide training and workshop themselves, or they can contract with subcontract with trainers to provide the trainings and workshops. And some of the topics and trainings that I put in the IRP could be parenting skills and child development, legal and policy issues in kinship care, formal versus informal kinship care, navigating the child welfare system, trauma-informed kinship caregiving, among others. So it's not an exhaustive list. It could go on as long as it makes sense. You can work with us on that. And this is, and I just want to go over the definitions a little bit. I know that we have a lot of experts on this call, and you probably know the definitions already. But I found that when I was doing research for this RFP, it is such a complex system that, you know, I really have to like outline everything and put everything in line and understand all the definitions in order to understand the system correctly. And then we have some information that are specific to this IRP as well. So I have mentioned several times in the IRP about the early stage of kinship care connections. And we have identified that we want to refer this to the first 3 months after the child has been living with relative or spending more than 50% of the time with a relative. So that is defined as the early stage of the kinship care connection. And fictive kin refers, so that is a term I use in the IRP, and it refers to individuals who are unrelated by either birth or marriage, but have an emotional significance relationship with another individual that would take on the characteristic of a family relationship. So fictive kin could be informal or formal kinship caregivers. And formal kinship refers to when public child welfare systems are involved in placing children with relatives, including fictive kin, which I just mentioned, through the foster care system, whether licensed or unlicensed. And then the definition of informal kinship refers to when children live with relatives, including fictive kin, and are not involved in public child welfare system, nor in the custody of the state. And the definition, I put this in the IRP, so I'm gonna define it as well. But we, so the King County Kinship Collaborator Network is something that we will ask funded applicants to join. And it's a network currently sponsored by Catholic Community Services and supported by the City of Seattle, Aging and Disability Services. It's a collaborate partnership among more than 30 organizations throughout King County, and their role is to respond in a more comprehensive way to the specific needs of kinship families and caregivers. And they have meetings that are held monthly on the 4th Tuesday of every month. I'm not sure if that's still the same during COVID, but I know this is prior to COVID, and I'm guessing it will be resumed once COVID is over, right? Being stabilized. And the definition of kinship care, as all of you know, is the full-time care and nurturing of a child by relatives, members of the tribes or clans, godparents, step-parents, or any adult who has a kinship bond with a child. So this definition is flexible. And kinship caregiver is a person who is providing the full-time care and nurturing for a child of their relatives, their tribes or clans, or any child with whom they have a kinship bond with. And seniors, for the Levy's definition, is a person who is at least 55 years old.
Nikki, in the chat, Stacy raised the question, do senior caregivers caring for their adult children with disabilities fit the description for this RFP?
Yes. Sorry, I think you cut out a little bit, Regina. Let me see. How old are the adult children, Stacy? At what age do you refer to as an adult? Over 18, okay. I think they should qualify since this RFP is for the kinship caregivers. So the clients or the recipients of the services and funding are kinship caregivers who are 55 and older. So as long as the caregiver is 55 and older, they should qualify. Okay, you have a chance to ask more questions at the end, but I want to give people a chance. Is there anyone else that have questions at this point? Okay, great. So the outcomes for this RFP is that the RFP seeks to ensure senior kinship caregivers have access to supports that enable them to maintain their health and well-being and be successful in their roles while providing for the children in their care. And the goal is to decrease isolation, promote inclusion and accessibility, and increase opportunities for senior kinship caregivers to receive the supports they need, which I think is very important, especially to help maintain their health so that they can continue to provide and take care of the children in their care. Focus populations for this IFP. So while it is open to all applicants, there, especially for seniors 55 and over, we have identified a few populations that have a higher rate of out-of-home placement, as well as becoming kinship caregivers. So we want to prioritize funding for those populations. So in order to be eligible for this program, they must be seniors defined by the Levy as 55 and older, and of course have to live in King County. And the funding will be prioritized for programs that serve or have effective outreach strategies to those who identify as, or providing care for children who are either identified or might as grow identify as Native American, African American, Native Hawaiian Pacific Islanders, or Hispanic or Latino. And funding will also be prioritized for programs that serve kinship caregivers who are in the early stages of the caregiving arrangement. So the first 3 months that they receive the children in their care. And it will be prioritized for kinship caregivers who meet the definition of informal kinship caregivers. So like I mentioned, it would be open to formal kinship caregiver as well. But the feedback I heard was that informal kinship caregivers have less access to services and resources. And therefore, we want to prioritize this funding for them. So the funding for this IFP will be available from October 1st, 2020. Hopefully we'll have the contracts signed by then until December 31st, 2023. We have a total of $948,348 for the 5-year period. And the 2021 to 2023 funding is contingent on approval of the King County Council budget. And I know that the fundings have been allocated for those years, but things might change. For example, the pandemic, it didn't affect our funding yet, but it has been affected the mid funding, which it's through the sales tax. So there have been significant impacts for providers and programs that are funded by the mid sales tax. So I mean, that could potentially happen to us as well. But we have put aside around $1 million for this funding for the next 5 years. So for 2020, we have $198,348. And from 2021 to 2023, we'll have $250,000 per year. And the first year, it's we only have a few months left, but the amount it's higher. So we want to account for startup costs. If you are new organizations and you need funding to build your programs or start your program, there are some funding for that as well, and there can be accounted for that. So for the budget templates, there are 2 budgets for this IFP. One is for a single program component, and it is the attachment D1, which is under the library section in ZoomGRANTS. And there's also a budget template for multiple program components, which is attachment D2, which is under the same library section in ZoomGRANTS. So if you only apply for one program component, you will only need to complete the single program component budget. If you want to apply for the multiple program components, 2 or 3 of them, you would need to complete the budget template for the multiple program components. And if we have time toward the end of the presentation today, I can pull up the budget and show you. And the budget templates, so it will include a tab for initial funding requests for this calendar year, as well as the annual funding request for 2021 and 2023 to 2023. And in order to be eligible for this RFP, we are open to all organizations, but specifically to nonprofit organizations, community-based organizations, tribes and tribal organizations, public or governmental agencies, small nonprofits, people of color-led organizations, Native community organization led by LGBTQ, or cultural specific organizations are encouraged to apply. So like I mentioned earlier, we led with equity and social justice. So we want to give those small organizations a chance to apply for and have access to our funding if they haven't had a chance before. And the funding for this strategy will also prioritize organizations that have not previously been awarded and are not currently receiving funding from King County VSHSL, as well as organizations that have not been awarded longer term funding before. So if you have only been awarded short-term funding for 1 year or a few months, you would be prioritized for this funding. Right, so I will go over some of the contract requirements for this RFP. You can find more information about that on page 11 to 13 of the RFP. But one of the things that will need to be completed after we sign a contract with you, it's to complete something called the performance measurement and evaluation. It's called the PME plans. And although you're not gonna have to do that now, the program model that you propose in your application should account for the strategies anticipated core performance measures. And I will go over those in the next few slides. Another requirements for the contract is client level data. So we require contractor to submit client level data, and those informations will be collected continuously and be reported quarterly via an online platform called CORE. So it's the acronym for Client Outcomes Report Engine. And the data collected from this will help us to assess the quality of services and client outcomes. And in addition to collecting client level data, we will require the contractor to submit an annual narrative report and possibly aggregate client level data as well. So for the annual report is to share information about operations, client stories, system change efforts, and all the information that we put in the report to share with the community as well as councils. The funded entities will be asked to complete a wage survey as well. And the study will aid the community in to better understand how compensation might be contributing to staff turnover and quality of services. And we'll work with you on that survey. You will also be asked to complete a client satisfaction survey, which we will work with you to develop a method for that as well. Right, and then if you're funded, these are some of the other additional requirements that we would like for you to do. So for funded entities, we are looking for entities that can provide services. Your services must be coordinated and aligned with other VSHSL funded organizations and system partners to better serve King County as a whole. And participation in VSHSL meetings and trainings, if they are convened, and we will send more information about that if you are funded. As I mentioned earlier, you will be asked to join the King County Kinship Care Support Network or Collaborator Network which is sponsored by CCS and supported by City of Seattle. And then we'll also ask you to join the Community Living Connections Network as well, which is supported by City of Seattle ADS and CLC, which all of you are familiar, is a network of providers and system partners that help adults facing aging and disability issues get the information and support they need to make informed decisions. And that could include older adults, adults with disabilities, the caregivers, families, and professionals. Okay, so the PME plans, which is the performance measurement and evaluation plans, is one of the requirements that will be completed after the contract is signed. So we have a team of PME that will work with the contracted providers to complete the PME plans. When you submit the program model, it should reflect these 3 performance measures. Keep in mind that this is the things that we'll be measuring. And the information I put on here are just samples, and it might not be the same as the questions or the measurements on the actual PME plan. But some examples, so the 3 questions are the 3 performance measures that we will be looking at. 1, how many people were served, which impacted by your program? How well did your program serve people? And then how are those served better off? And an example of measurement under number 1 could be the number of senior kinship caregivers supported by your program. A few examples under how well is how long do they have to wait before you reach out to them to support it? And then the percentage of senior kinship caregivers within the focus populations. And I went over focus populations earlier, is in the RFP as well. So you can look at that. How are they better off? So it could be measured by percentage of senior kinship caregivers connected to additional resources, include financial, social, or other resources, or it could be measured by percentage of senior kinship caregivers who reported being more successful in their roles, or both. So it just depends on your program model. And when you work with our PME, there might be 1 measurement under each question or multiple measurements. The timeline for the RFP is right here. So the RFP was released on July 22nd. The bidders conference, it's July 30th, which is today, hosting right now. The final day for small agencies to submit requests for technical assistance, and I will go over technical assistance in a bit. It's 2 weeks before the closing day, which is August 19th. The final day to submit questions is August 26th. So I just want to say that since the RFP is open, we have to follow procurement policies, and so we will not be able to answer individual questions. So you can either, ask me questions today or submit the questions via ZoomGRANTS. There will be a tab on there that says contact admin. You can click on there and it will send the email directly to me, or you can send that email directly to me. Responses will be compiled, and the questions will be compiled, and responses will be uploaded periodically. So it will be updated regularly onto ZoomGRANTS. It will be uploaded under the library section. The responses to the applications will be reviewed and rated in September after it's closed. And if necessary, we might hold interview with applicants in September as well. We are hoping to notify the awarded applicants or notification of award decisions by the end of September, and hoping to begin the contract on October 1st. But things always happen, and so there might be changes to the date on this timeline. So you would need to submit your proposals by 11:59 p.m. on September 2nd, which is the closing date. And in order for the package applicants to be accepted, you need to submit all the following documents. So in ZoomGrants, which I can pull up in a bit to show you, you would need to include, provide responses to the summary questions, and there is a tab for that in ZoomGrants. You would need to upload a completed geographic service intent form, and this document is uploaded under the library section, and so you have to complete that and then upload it to the required document tab in ZoomGrants, and I can show you that in a bit as well. You would need to respond to the narrative questions, which is a tab in ZoomGrants. It will have a list of questions that you will have to provide responses to. And then you would have to download one of the budget templates, so either single program component or multiple program components, and complete that, and then upload that to the required section in ZoomGrants. And then there is a tab in ZoomGrants for you to complete the organizational equity chart, which I will show you in a bit. So those are all the things that you need to complete for your applications to be considered. For the rating criteria, this is a very high level of what we will be looking for, but there is detailed information in the RFPS itself, so you can read more information about what we are looking for in there. And it's on pages 15 to 17 of the RFP. So we will, you will be rated on your program model, which is 35 points. You'll be rated on your organizational capacity and experience for 25 points, partnership and collaboration for 10 points, equity and social justice, 15 points, budget and fiscal 10 points, data collection 5 points. And if interviews are necessary, it will be a 25 points total. And all this rating will match with the narrative questions that you will find on ZoomGrants. And I can go over the rating process quickly. So I am in the process of putting together a review panel, and I want it to be as diverse as possible. And it will include staff from King County, from ADS, as well as experts in the community on kinship care. And it will have some of the council member staff as well, but they won't be served as voting members. They will be there for the discussion. And the review panel will make recommendations on who to fund. And I will be making a presentation with the division director as well as the department director. So besides the funding that I mentioned earlier, we have another funding called technical assistance, and it is available for small organizations. And the definition of small organization is if you have fewer than 20 FTE, so not people, but FTE. So if you have 250% staff, that would be equivalent to 1 FTE. So your organization has to have less than 20 FTE and less than 4 million operating budget in prior fiscal year. And what this funding does is we contract with a number of TA providers, and their role is to assist you in determining appropriate fit between your proposal and RFP, provide guidance on how best to answer questions, support your application development, including editing and budget review. So if you meet the definition, there is an attachment E in ZoomGrants with information of other contractors, information of other TA providers that you can reach out to. The last day for you to contact them for assistance is August 19th. I believe we have some of them on the call today. So if you have any questions about this later, either them or myself can answer your questions. And along the technical assistant, we have capacity building funds as well. And again, you have to meet the definition of a small organization to apply. And that definition is the same as the one I mentioned earlier. So less than 20 FTE, as well as less than $4 million operating budget in the prior fiscal year. And this capacity building funds is to support organizations, and it's just a one-time cost associated with building the capacity, and it's not designed to support ongoing needs. And some example that could be approved under these fundings are, like support for human resources, accounting of fiscal operations, leadership development, then some of the things that, so the main goal of this is to support your organization structure so that you can focus on using the full or the funding amount towards services. So on the budget, there will be a tab called TACB request. If you qualify and if you believe your organizations need this assistance, you can fill out that tab, and then we will meet with the management team to determine whether it will be approved or not. And we will work with you on that as well. Oh, and if you believe you qualify, there are a few questions in the summary questions, attachment A, which is also in the summary questions tab in ZOOMGRANTS that you will need to respond to. Okay, so going over ZOOMGRANTS a little bit, I'm not sure if everyone is familiar with ZOOMGRANT, but it's an online application portal where applicants can access and view RFP information and submit their applications. All the RFP materials are posted on ZOOMGRANTS under the library section, and I will be uploading responses as well as other updates on there as well. All applications must be filled out and submitted via ZOOMGRANTS. Questions today and those submitted in writing will be posted to ZOOMGRANTS under the library section. And this is the link to ZOOMGRANTS. So before we go to Q&A, let me show you the ZOOMGRANTS platform real quick, and then the budget template as well. And then you will have a chance to ask me any questions that you have. So give me 1 second. So when you log into ZOOMGRANTS, it's not going to look like this. This is on my end. So you will be able to see something like this. It's loading. So you will have to sign up for an account if you want to apply for this funding. There are information about the investment right here. Investment period, the bidders conference, which is today, and then it will be closed on the 2nd, which is on here. And then if you scroll down, this is the library section that you can find all the RFP documents under. So there are the RFP itself, and then the summary questions. This is the geographic service intent that you would have to download and upload to the required document tab right here. There's an attachment for narrative questions. There are 2 attachments for the budget for single program and multiple program components. There is an attachment for technical assistance, which includes the TA providers that I mentioned earlier. And then there's an attachment for the boilerplate, and then general terms. When you log in, you would have to answer questions under the summary questions tab, which is right here. And then you would have to answer provide responses to the narrative questions, which is under this tab. And then you would have to complete the organizational equity chart, which is right here. And then the required documents is where you upload the geographic service intent form as well as one of the budgets. So it will be right here, you complete it, and then you could just upload to here. Okay, and I just want to say that ZOOMGRANTS can sometimes be difficult to navigate. And you know, there are some issues that we have run into in the past. So just make sure that you submit your applications early and don't wait until the last minute. Okay, let me pull up the budget to show you real quick. Okay, so this budget is for the single program component, and there are instructions in there for you. It's in the IRP as well as right here. I have a tab for all the instructions. So if you have any questions, you can refer to the instructions right here. There's a tab for 2020 personnel detail. So this is where you put in the personnel needs for your program in 2020. And then there's a tab for 2020 program budget and the information. So you don't have to fill this out. The information for salaries and benefits will be pulled over from the personnel tab. And then you would have to fill out everything else. There is a tab for the annual personnel detail for 2021 to 2023. You would fill that out here. And then there's a tab for 2021 to 2023 annual program budget. And again, the information for the prior tab will be pulled over to here. So you don't have to fill this out, but you would have to fill out everything else. And then all the informations will be pulled over to this tab. We have put in the formulas so that you don't have to put in the numbers. If you fill out the other 4 tabs, the information will be pulled over here. We would need you to fill out the budget narrative though. That will give us more information if you want to provide to us. For example, if you put down 50,000 for transportation, you know, give us a bit more details on what that transportation entails. So is that to pay for staff or to pay for mileage or whatever you want to include under transportation? Give us some more information so that we can understand your program and budget better. Or if you want to hire a program coordinator, you can put it right here and tell us a little bit of what the role is. And then there's a tab for TACB, Technical Assistance and Capacity Building Fund. So if you believe your organization qualifies, you can fill out this tab right here. And I'm opening up the one for the multiple programs. This one is the budget for the multiple program components. So again, there are instructions right here. The only difference between this one and the other one is that it has the column for the multiple programs. So I know that it's not visible, but if you click on it, there should be a drop down for you to select the components that you would like to apply for. So let's just say you want to apply for all 3 program components. You can do kinship mentoring, and then you fill out the information for that program. And then you can do flexible funding, and then you can fill out information for that. And then same with training. And then it has that feature in all of the other tabs. And then all the information you completed will be pulled over here, which we put in formulas already. So you don't have to worry about filling this out or do calculations for that. And there is a tab for TACB for that as well. So if you apply for multiple programs and you meet the definition of small organizations, you can apply for that funding as well. All right. I believe, let me see if I'm missing anything. Can you all still see my screen okay?
Yes. And Nikki, just want to let you know there's a few questions in the chat. I know you're getting to the questions.
Okay, great. Yeah. I think we have covered everything. So I will go over the questions now. Just wanna say again that I appreciate everyone to be on the call today. And if I don't, I will try my best to answer your questions. If I don't know the answer, I will get back to you. Let me go into the chat here. Will the PowerPoint be in the library? Oh yeah, so Virginia answered that already. So there's a question from Nicole, and the question is, the 2021 to 2023 budget tab is for the full range 3 years or the annual cost over those 3 years. So let me pull that up again. This one is for, it's gonna be per year. So the total, let me see if I answer this question correctly. Yes, it's gonna be the annual cost over those 3 years. So for example, it's per year amount request. So you could put the amount per year right here for the next 3 years. And then in the total, it would have the total for those 3 years. It will be added to the total tab. Let me take a look here. Yes, so it's gonna be per year, and then the total amount will be added to, let me see. Actually, it will be added to this tab right here. And then the next question is from Chris. If an organization applies for more than one of the 3 areas of work, will they only be considered for all areas applied for, or might they be awarded for one of the areas they applied for and not another? Could potentially be both. I mean, we will have to see the number of applications that we receive, and we would have to see, you know, the different program components that they apply for. So I think potentially you could be awarded for one of the multiple program components that you apply for. Okay, and then there's a question from Ursula. Does the program need to be freestanding, or can it be part of a larger mentoring program for adults? It's a good question. Let me see. I think that because the need for this population is so specific, we would prefer it to be freestanding. But if you have a larger mentoring group already and you want to incorporate this in, you're welcome to submit your proposal, and you know we'll see what it looks like. But I think we would prefer it to be a freestanding, you know, program that focus specifically on kinship caregivers. All right, I think I have answered all the questions in the chat. Does anyone else have any questions that you want to ask me? The flexible funding is available for all 4 years, correct? Let me. So this is the RFP itself. I'm not sure if you had a chance to see it, but Let me. So for flexible funding, it is available for all 4 years for 2020, and it is 100,000 for all 4 years. Okay, question from Julian. Would an intergenerational program qualify, meaning older adults working with teens? Can you say a little bit more, Julian? For which program component? Are you referring to the mentoring part of the training, or which one are you referring to? The mentoring of flexible funding. Okay. Yes. So again, to be eligible for this program, you have to be a kinship caregiver 55 and older. So as long as your program serves kinship caregivers who are 55 and older, your program should qualify. Great. Is there any other questions? There's a question from Ursula. Can one print out the grant forms questions? Are you referring to the narrative questions? If you are, then the answer is yes. If you go back to ZOOMGRANTS that I showed earlier, there's an attachment for just attachment C, and it has other questions on there. But you would have to answer the questions in ZOOMGRANTS. So we open it. So all the documents in ZOOMGRANTS, I have it right here. So if you need to print it out and complete it offline and then transfer it up, you can totally do that. So this is attachment C with the questions, which are identical to the ZOOMGRANTS tabs for narrative questions in ZOOMGRANTS. Okay, is there any other questions? Those are great questions. All right. If nobody else has any questions, we can go ahead and conclude the meeting. Again, if you have questions, feel free to email me. And my email is right here. It's on the RP as well. And in ZOOMGRANTS, there is a tab in ZOOMGRANTS that you can just click on and see what it is. What's wrong with this? But there should be a tab right here that indicate contact admin that you can just click on and send me the email directly. Or if it's easier, you can just put in my email and send the question to me. And I will compile those questions and provide responses, and we'll upload the documents to ZOOMGRANTS. Okay, great. Well, thank you everyone for joining today. And I look forward to the applicants in the process and any questions that you might have later. Thank you. Take care, everyone. Bye-bye.